Say goodbye to dental implants. Seniors, science now shows a natural way to regrow teeth and strengthen your gums without surgery, pain, or expensive procedures. Stick around, because the final method is the most powerful and could completely transform your oral health. The problem this remarkable research aims to solve is widespread and deeply personal for countless individuals around the globe, perhaps even for you. Did you know that the average adult loses at least one permanent tooth by the age of 44? And for those reaching 65 and beyond, nearly 30% of adults find themselves having lost all their natural teeth. Worldwide, tooth loss affects billions, impacting much more than just the ability to properly chew food or speak clearly. It deeply affects self-confidence, quality of life, and overall well-being. Currently, if you lose a tooth, the primary solutions involve dental implants, which, while effective, are incredibly expensive, often costing thousands of dollars per tooth, require significant surgery, and demand months of healing. Other options include bridges, which necessitate altering healthy adjacent teeth, or dentures, which many can attest are rarely as comfortable or functional as natural teeth. This new research offers a truly revolutionary alternative to these long-standing challenges. What makes this emerging science so incredibly revolutionary is the astonishing fact that humans actually possess the dormant genetic blueprint to grow 3 sets of teeth, not just the 2 we typically experience. We develop our baby teeth, then our permanent adult teeth, and after that, nothing more usually grows. However, that potential for a 3rd set, a hidden capacity to regenerate, is undeniably present within our very DNA, merely waiting to be awakened. In fact, many mammals across the animal kingdom possess the incredible ability to regenerate teeth throughout their entire lives. Just think of a shark, which can grow thousands of new teeth over its lifetime. This prompts a critical question. Why can't we? This is precisely the question Japanese scientists believe they have finally answered, having meticulously uncovered how to unlock that long-dormant potential within us. Spearheading this monumental research is the distinguished Dr. Katsu Takahashi, whose pioneering work is being conducted at Kitano Hospital in Osaka, Japan, in close partnership with the renowned Kyoto University. It's crucial to understand that this isn't some experimental startup. These are highly respected, world-renowned institutions with extensive multi-decade experience in both regenerative medicine and advanced dental research. Dr. Takahashi himself has dedicated over 15 years to the intricate study of tooth development, and his dedicated team has been focused specifically on this ambitious tooth regeneration project since the early 2010s. What truly sets their innovative approach apart is that they are not attempting to grow teeth externally in a laboratory for transplantation. Instead, their profound goal is to stimulate your very own body to naturally grow brand new teeth by leveraging and reactivating the biological mechanisms that are already inherently present within you. The extensive journey to reach human trials has been both deliberate and rigorously methodical, beginning with fundamental research into tooth development, progressing through sophisticated computer modeling, followed by meticulous animal studies, and now, finally, advancing to human trials. This careful, systematic progression instills immense confidence that they are approaching this groundbreaking therapy with utmost caution and safety. Now, let's delve into the truly fascinating science underpinning this breakthrough. And please don't worry, I promise to explain it in the clearest, most understandable way possible, even if biology wasn't your favorite subject back in school. The core secret to this entire remarkable discovery revolves around a particular protein called USAG1. You can envision USAG1 as a kind of biological stop sign, effectively halting tooth development. During the typical course of human development, once our permanent adult teeth have fully emerged, USAG1 essentially sends a clear signal to our mouth, instructing it, "That's enough teeth, cease making any more." Yet here's the truly incredible part. Even after our adult teeth are in place, we still possess dormant tooth buds nestled within our jaws. These tiny buds are like sleeping seeds, containing the inherent potential to develop into fully formed teeth, but it is USAG1 that steadfastly prevents them from ever activating. It's much like having a beautiful garden brimming with countless seeds that simply refuse to sprout because a persistent voice keeps telling them it's perpetual winter. So, what does this ingenious new drug accomplish? It is an antibody specifically engineered to precisely target and block the effects of USAG1. When this molecular stop sign is effectively removed, those dormant tooth buds, freed from their inhibition, finally awaken and begin their natural process of developing into actual functional teeth. The researchers themselves describe this mechanism as facilitating the growth of a third set of teeth beyond our familiar baby and adult sets. The scientific term for this precise drug is an anti-USAG1 monoclonal antibody. Monoclonal antibodies are exceptionally accurate and discerning. They operate much like molecular smart bombs, designed to bind to and neutralize only one specific protein without affecting other critical biological processes. This incredible precision is absolutely vital, ensuring that the drug affects only tooth development and does not interfere with other vital parts of your body's complex systems. What is truly elegant about this entire approach is that it introduces nothing artificial into your body. The drug simply lifts a natural internal restraint, allowing your body's inherent systems to perform what they are already designed and genetically programmed to do. Crucially, the new teeth that ultimately grow are genetically identical to your original natural teeth, developing from your own stem cells encoded with your unique DNA. Before advancing to the critical stage of human trials, Dr. Takahashi's dedicated team conducted extensive animal studies, and the results from these trials were nothing short of spectacular. In mice, for instance, a single injection of the anti-USAG1 drug was consistently sufficient to trigger the impressive growth of entirely new teeth. These comprehensive animal studies were not merely about proving the drug's efficacy, they were also profoundly important for rigorously establishing robust safety profiles and determining the optimal dosing strategies. The researchers meticulously needed to understand how long the therapeutic effects of the drug would last, to identify if there were any discernible side effects, and to meticulously observe the long-term health and well-being of the animals after receiving the treatment. The overwhelmingly positive news emanating from these studies is that the animals exhibited no significant adverse effects whatsoever from the treatment. The newly regenerated teeth integrated perfectly without interfering with any existing teeth, and there were no signs of toxicity, with the animals maintaining perfectly normal dental health throughout the observational periods. As of early 2025, the initial human trial is currently ongoing, and while detailed, comprehensive results have not yet been publicly released, the fact that the trial is proceeding precisely as planned strongly indicates that no major safety concerns or unforeseen issues have emerged, which is exceptionally encouraging. While the immediate focus of the current trial is on healthy adults, the researchers harbor far more ambitious and expansive plans for who this life-changing treatment could ultimately help. The eagerly anticipated next phase of trials will specifically target children suffering from congenital anodontia, a condition where individuals are born missing one or more permanent teeth. This condition affects approximately 5% of the global population and can range dramatically from the absence of a single tooth to the complete lack of any adult teeth whatsoever. However, the potential impact stretches far beyond these specific cases, promising a fundamental shift for anyone currently facing the difficult choice between costly dental implants or less than ideal alternatives. The psychological and social impact of such a therapy could be truly enormous, as tooth loss profoundly affects self-confidence, hinders social interactions, and can even subtly influence career prospects. Being able to naturally restore missing teeth could have profoundly transformative effects on countless individuals' overall quality of life, offering them a new lease on life with a confident smile. So, for many of you wondering, when might this life-altering treatment finally become available to the general public? The dedicated researchers are cautiously but optimistically projecting commercial availability sometime around the year 2030. Looking beyond congenital conditions, this remarkable treatment possesses the potential to entirely revolutionize dental care for a broad spectrum of individuals. Cancer patients who have tragically lost teeth due to harsh radiation therapy or chemotherapy, people who have suffered severe dental trauma from accidents, and perhaps most significantly for many of you, elderly individuals who have experienced the cumulative loss of multiple teeth over the years. This isn't just about replacing what's lost. It's about giving back a fundamental part of yourself naturally and effectively without the drawbacks of current methods. Get ready, because the future of dental health is not just promising, it's truly transformative.